All right, ready to dive deep into the world of heart valves. Today we'll be exploring these unsung heroes of the heart with excerpts from Timmy Smith, Introductory Medical Surgical Nursing.
It's going to be fascinating.
By the end, you'll be listening to your own heartbeat in a whole new way, I guarantee.
It's remarkable how these tiny structures play such a vital role, keeping our bodies running smoothly.
Think of your heart as this incredibly intricate pump.
Right.
And the valves, they're like gatekeepers, making sure blood flows in the right direction. Always. We've got four main players here, right? The aortic, mitral, tricuspid, and pulmonic valves.
Two on the left, two on the right, each with a very specific job to do, like a perfectly choreographed dance, keeping that blood moving.
Love that analogy. But as with any well-oiled machine, sometimes those gatekeepers can start to, well, malfunction. What kind of things can throw a wrench into those works?
It varies. Sometimes it's something we're born with, a congenital defect. Sometimes it's just wear and tear as we age, almost like a hinge getting rusty. Infection can also cause damage, and even the aftermath of a heart attack can impact these vital valves.
Okay, got the basics down. But I'm curious about those sounds beyond the classic lub-dub. The book mentions S3 and S4. What's the deal with those?
Think of those as the whispers and murmurs your heart might make when things aren't quite right. The lub-dub, that's the main performance. But these extra sounds, they're like subtle cues that can tell a trained ear a lot about what's happening backstage.
I like that backstage. So S3, also known as a ventricular gallop, what does that tell us?
Well, with young people and pregnant women, it can be totally normal. It's this low-frequency sound in early diastole. That's when the ventricles are filling with blood. But in those over 40, it can signal a problem, you see, like trying to fill a stiff balloon. The heart's working harder than it should.
And that stiffness could be caused by...
Could be a lot of things. Heart failure, anemia, even too much fluid intake, believe it or not. It's a sign that the ventricle might not be relaxing properly, not accepting that incoming blood as easily as it should.
Interesting. So then we have S4, which the book calls the atrial sound.
Right. That one happens late in diastole, just before the Lud sound. It's associated with, well, a stiff ventricle. And that can be a big red flag. Imagine trying to force that last bit of air into an already inflated balloon. It takes more effort, right? Creates a different sound.
So S4 could point to conditions like...
Exactly. Conditions like left ventricular hypertrophy, that's where the heart muscle thickens, or ischemia, where there's reduced blood flow to the heart muscle.
It's amazing how these subtle differences in sound could be so revealing. The book mentions that these sounds can sometimes even be felt as a vibration on the chest wall.
Absolutely. It's called a thrill, a palpable sensation that can accompany those S3 and S4 sounds. Really highlights the power of careful listening and examination when it comes to diagnosing heart conditions.
Speaking of sounds, you got to talk about murmurs, thrills, and brutes. I understand these are all sounds that can clue us in to potential valve problems.
Think of them as the heart's way of signaling, hey, something might be off here.
Right.
A murmur, for instance, it's an unusual sound, heard between heartbeats, like a whooshing or swishing. It can be harmless, especially in kids or during pregnancy, but it can also be a sign of something more serious.
And a thrill, that's literally the feel of a murmur, right?
Exactly. It's that palpable vibration. You might feel it on the skin over the heart or a blood vessel. It's literally the turbulence of blood flow you can feel.
Wow. And then there are brutes.
Ah, those are the sounds you hear over partially occluded blood vessels, like a narrowed carotid artery up in the neck. Think of it like a kink in a garden hose. You know how the water flow becomes turbulent, creates that whooshing sound?
Makes sense. So these aren't just interesting noises. They're vital clues when diagnosing valvular disorders.
Precisely. These sounds, whether it's a murmur, a thrill, or a brute, can tell us a lot. Like how severe a condition might be. Murmurs, for example, they're graded on a scale of 1 to 6.
Okay.
Grade 1, that's very faint, barely audible. While a grade 6, that's so loud you can hear it without a stethoscope.
Wow. So it's almost like a volume control for heart sounds, huh? The louder the sound, the bigger the problem.
In a way, yes. And that's just one of the many tools doctors use to assess and diagnose valvular disorders.
Okay, sounds good. Now that we have a good handle on those basic sounds, I think it's time to delve into some specific valvular disorders. Shall we? Starting with aortic stenosis.
Aortic stenosis, essentially a narrowing of the aortic valve, the one controlling blood flow from the left ventricle into the aorta.
And what causes this narrowing?
Well, it can be a number of things. Sometimes it's age-related, Buildup of calcium deposits on the valve leaflets makes them stiff and less flexible, like a door hinge that's become rusty and hard to open.
So it gets stuck.
In a way, yeah. But it can also be something people are born with, right? Congenital defects, where the valve is malformed from birth. That's another common cause.
So how does this narrowing, how does it affect the heart's ability to function?
Imagine trying to force a lot of water through a very narrow opening. It takes a lot more effort. That's essentially what's happening with aortic stenosis. The heart has to work harder to push blood through that narrowed valve.
And over time, that extra strain can lead to.
A lot of problems. People with aortic stenosis might experience fatigue, shortness of breath, even dizziness and fainting, all signs that the heart is struggling.
What about chest pain? Is that also a symptom?
Absolutely. As the condition progresses, people might experience angina, that's chest pain caused by reduced blood flow to the heart muscle itself.
So it's almost like a domino effect, with one problem leading to another. Are there any specific findings on physical exam that would point to aortic stenosis?
There are, yeah, the carotid pulse, for example, the one you feel in your neck that might feel weak.
Because of the reduced blood flow.
Exactly. Less blood squeezing through that narrowed valve. And when listening to the heart sounds, you might hear a split S2 sound.
Like the dub becomes more of a lub-T-tub?
You got it. It happens because the aortic valve is closing later than it normally should due to the narrowing.
So diagnosing aortic stenosis involves looking at the whole picture, symptoms, physical exam findings, and of course, diagnostic tests.
Exactly. Tests like a chest x-ray, an electrocardiogram, an echocardiogram, all can help visualize the heart, see how bad the narrowing is. And sometimes a cardiac catheterization might be needed to get a more detailed look.
Okay, so once you've diagnosed aortic stenosis, what are the treatment options?
Well, the goal is to improve blood flow and relieve that strain on the heart. Medications can help manage symptoms, slow the progression, like diuretics, beta blockers.
But often, surgery is needed to address that valve problem, right? What are the options there?
There's a balloon valvuloplasty. A balloon is inserted to widen the narrowed valve, but often the best option is valve replacement.
And that's where things get really interesting. Tell me about those pig and cow valves.
Right, you've got a choice. Mechanical valves, they're durable, but you'll need lifelong anticoagulation medication. Or biological valves, these are made from pig, cow, or even human cadaver tissue.
Wow, it's like getting a heart valve transplant from a pig or a cow. Amazing. What are the pros and cons of each type of valve?
Well, mechanical valves, they're incredibly durable. But the downside is needing those lifelong blood thinners to prevent clots from forming on the valve.
I see. Makes sense. So biological valves are a good option for people who can't take those blood thinners.
Exactly. They're much less likely to cause clotting issues, but they don't last as long as mechanical valves, you see. They eventually wear out, need to be replaced.
So it's a decision that needs to be made on a case-by-case basis, considering age, health, and all that.
Absolutely. And it's a conversation to have with your doctor. Weigh the risks and benefits.
Now, besides those two, any other advancements in aortic stenosis treatment?
There's a less invasive option called transcatheter aortic valve implantation, or TEVR.
TVR.
It's a newer procedure. A new valve is inserted through a catheter in the groin, avoids open heart surgery.
Sounds amazing. Suitable for everyone.
It's a fantastic option for many people, particularly older adults, or those who are at higher risk for complications from traditional surgery. But not for everyone. Your doctor would determine if it's right for you.
That makes sense. It's fascinating how far medical technology has come. Okay, aortic stenosis covered. Let's move on to another aortic valve disorder. Aortic regurgitation.
Aortic regurgitation, or aortic insufficiency. It's a condition where the aortic valve doesn't close properly, you see. Blood leaks back from the aorta into the left ventricle.
So it's like a leaky faucet, dripping blood back into the heart instead of it all being pumped out to the body.
Great analogy. And just like a leaky faucet wastes water, this backward flow of blood puts extra strain on the heart, particularly that left ventricle.
What causes this leaky valve?
Several things. It can be damage to the valve leaflets themselves or the papillary muscles that support them.
We talked about rheumatic carditis and endocarditis earlier. Can those also cause aortic regurgitation?
Absolutely. Can damage the aortic valve, lead to regurgitation.
And what about that weight loss drug, fen-phin? Didn't that also contribute to aortic regurgitation?
Yes, it was linked to cases of aortic regurgitation. A good reminder about those potential side effects of medications.
Absolutely. How does aortic regurgitation affect the body?
Early stages, you might not notice much. But as it progresses, you might feel your heart pounding, especially when lying down.
Why lying down?
When you lie down, more blood returns to the heart, and that leaky valve becomes more noticeable, like turning up the pressure on a leaky faucet.
The leak becomes more obvious, right?
Exactly. And as the left ventricle works harder to compensate for that regurgitation, you might get tired, feel short of breath.
And what about chest pain?
Yeah, you might experience chest pain too, similar to angina.
Now, the water hammer pulse, that really stood out to me. Can you explain that one?
A water hammer pulse, it has this high systolic blood pressure, but a low diastolic blood pressure. It's like when you feel the pulse, it's very strong, bounding, followed by a quick collapse.
So it really does feel like a hammer hitting a water pipe.
It's quite distinctive, yeah. Happens because that leaky aortic valve allows a large volume of blood to be ejected into the aorta with each heartbeat, causing that high systolic pressure. But then, as the blood leaks back into the ventricle, the diastolic pressure drops quickly.
So what else, besides that water hammer pulse, what other methods are used to diagnose aortic regurgitation?
Combination of tools, an echocardiogram, a chest x-ray, and an ECG, all help us visualize the heart. See how bad the regurgitation is, how well the heart's functioning overall.
And sometimes a cardiac catheterization for a more in-depth look?
Right. Provides a precise assessment of the valve and the surrounding structures.
Treatment time. What are the options for aortic regurgitation?
Often a multi-pronged approach. Start with lifestyle modifications, things like limiting sodium, managing stress.
Can help reduce the workload on the heart.
Exactly. And medications can also play a role, of course.
Like?
Diuretics, beta blockers, and vasodilators, they can all help control blood pressure and improve heart function.
But sometimes those alone aren't enough.
Right. If the regurgitation is severe, causing symptoms, surgery to repair or replace the damaged aortic valve might be the best course of action.
And like with aortic stenosis, there aren't those options for valve replacement. Mechanical valves and the biological valves.
Yes, the choice between those depends on several factors, of course. The patient's age, health, and lifestyle.
All right, aortic valve and its disorders, checked. Let's turn our attention to the mitral valve now. First up, mitral stenosis.
Mitral stenosis. It's a condition where the mitral valve, the one separating the left atrium from the left ventricle, becomes narrow. That narrowing restricts blood flow from the left atrium to the left ventricle.
And what causes that narrowing?
The most common cause is rheumatic carditis.
Okay.
It's an inflammatory disease, can damage the heart valves, makes them thickened and less flexible, often a consequence of untreated strep throat or scarlet fever.
Wow. So seemingly minor infections can have long-term consequences. How does this narrowing of the mitral valve affect the heart's function?
Well, as the mitral valve narrows, the left atrium has to work harder. It's like trying to squeeze a thick milkshake through a tiny straw. It takes a lot more effort.
I get it. And over time.
Over time, that extra effort can lead to enlargement of the left atrium. And as the pressure builds there, it can back up into the lungs, leading to pulmonary hypertension.
Pulmonary hypertension, that's high blood pressure in the lungs, right?
Exactly. And that can cause a whole host of problems. Shortness of breath, fatigue, even heart failure.
So what are some warning signs of mitral stenosis that people should look out for?
Fatigue and shortness of breath, especially with physical activity. You might also notice palpitations, a rapid or irregular heartbeat.
And in more severe cases.
People might have trouble breathing when lying down. Need to sleep sitting up to breathe easier.
The book also mentioned a cough that produces pink, frothy sputum. What's that about?
That's a sign of fluid buildup in the lungs, which can happen when the heart isn't pumping efficiently.
Definitely not good. And when listening to the heart, what kind of sound might indicate mitral stenosis?
You might hear a characteristic murmur, a sort of rumbling sound during diastole. It's the sound of blood struggling to get through that narrowed mitral valve.
So diagnosing mitral stenosis involves looking at those symptoms, listening to the heart sounds, using diagnostic tests like an echocardiogram, chest x-ray, ECG.
Absolutely. We need all the clues to get a clear picture.
And once you have a diagnosis, what are the treatment options?
Depends on the severity of the stenosis and the person's overall health, of course. In mild cases, lifestyle modifications can be helpful, like reducing sodium intake, managing stress.
And medication could play a role too, I assume.
Absolutely. Medications like diuretics, beta blockers, blood thinners can be used to control symptoms and prevent complications.
But sometimes surgery is needed to address that narrowed valve, right?
Right. There are a couple of surgical options. One is a commissurotomy. That's where the fused valve leaflets are separated.
So the valve leaflets are like doors that have gotten stuck.
Yeah.
And a commissurotomy is like separating those doors so they can open those again.
Perfect analogy. Another option is balloon valvuloplasty. A balloon widens the narrow valve.
And if those aren't suitable, you can always replace the valve, right?
Yes, if the valve is severely damaged, valve replacement might be necessary.
Okay, mitral stenosis covered. Let's move on to another common mitral valve problem, mitral regurgitation.
Mitral regurgitation, also known as mitral insufficiency, it's a condition where the mitral valve doesn't close properly, so blood leaks back from the left ventricle into the left atrium.
Okay, so another leaky valve, but this time it's the mitral valve not closing properly.
Exactly. Instead of all the blood being pumped out to the body, some flows backward, and that puts extra strain on the heart.
What are the main causes behind this leaky mitral valve?
It could be damage to the valve leaflets themselves or to the chordae tendineae, those cords that anchor the valve leaflets.
Rheumatic heart disease and endocarditis, can they also lead to mitral regurgitation?
Absolutely. They can damage the mitral valve and contribute to mitral regurgitation. Rheumatic heart disease is one of the most common causes of mitral regurgitation worldwide, in fact.
So how does this backflow of blood affect the heart and body?
Well, the backward flow can overwork the heart, leading to enlargement of the left atrium and ventricle.
And an enlarged heart isn't efficient at pumping blood.
You got it. It can also cause pulmonary hypertension as the extra blood in the left atrium backs up into the lungs.
So we're seeing a similar pattern with mitral regurgitation and stenosis, that backup of blood into the lungs.
Right. And in severe cases, mitral regurgitation can even lead to heart failure.
What are some warning signs of mitral regurgitation that people should be aware of?
Fatigue and shortness of breath, especially during exertion, those are common. You might also experience palpitations, dizziness, even swelling in the legs and ankles due to fluid buildup.
Okay. And when listening to the heart, are there any sounds that would point to a mitral regurgitation?
Yes, you might hear a diminished S1 heart sound, that lub sound,
The lub sound, why would it be diminished?
because the leaky valve doesn't close as forcefully, so it's a softer sound. Imagine a door that doesn't latch properly. It makes a less distinct sound when closing.
That's a great analogy. Is there a particular type of murmur associated with mitral regurgitation?
Often you hear this blowing sound that happens during systole. It's the sound of blood leaking back through that faulty mitral valve.
Okay, so to diagnose mitral regurgitation, you'll consider those symptoms, listen for the heart sounds, and use diagnostic tests like echocardiography, chest X-ray, ECG.
You got it. We use all those tools to arrive at an accurate diagnosis.
And once you have that diagnosis, how do you treat mitral regurgitation?
Just like other valvular disorders, it depends on the severity of the regurgitation and the person's overall health.
So in mild cases, you might start with lifestyle changes and medication.
That's right. Lifestyle changes like reducing sodium intake, managing stress, those can be helpful. And medications such as diuretics, ACE inhibitors, and beta blockers can also be used to control blood pressure, reduce fluid buildup, improve heart function.
But in more severe cases, you might need to consider surgery to repair or replace the valve.
Exactly. And when it comes to surgery, there are a couple of options. One is annuloplasty. That involves tightening the ring around the mitral valve, improve its closure.
So it's like reinforcing the doorway so the door can close tightly.
Exactly. And if the valve is severely damaged, valve replacement might be necessary. Just like with aortic valve replacement, there's the choice between mechanical and biological valves.
Got it. Okay, mitral stenosis, mitral regurgitation checked. One more mitral valve disorder left, mitral valve prolapse.
Mitral valve prolapse, or MVP. It's a condition that affects the leaflets of the mitral valve. Instead of closing smoothly, one or both leaflets bulge back into the left atrium during systole.
So it's not a narrowing or a leaking, but a bulging. Interesting.
Right. It's often called a floppy mitral valve because the leaflets don't stay in place during the heart's contraction.
And this condition is more common in women, right?
Yes, more common in women. And the exact cause is often unknown. But it can be associated with connective tissue disorders, which affect the structural integrity of tissues.
Now, this is interesting. The book mentioned that many people with MVP don't actually have any symptoms.
It's true. Many people with MVP live completely normal lives, never knowing they have it. And for those who do experience symptoms, they can vary quite a bit.
So what are some symptoms people with MVP might experience?
Some people might feel chest pain, palpitations, or fatigue. They might experience shortness of breath, lightheadedness, even trouble concentrating. Some people also report feeling anxious or having panic attacks.
So the symptoms aren't always just physical.
The mind-body connection is a powerful thing. Sometimes heart conditions can manifest with both physical and emotional symptoms.
Now, when diagnosing MVP, is there a particular sound you listen for?
One of the key signs of MVP is a click sound, heard during systole.
What causes that clicking?
It happens when the valve leaflets prolapse, or billow, back into the atrium. Think of it like a sail snapping in the wind.
So to diagnose MVP, you'll listen for that click, use an echocardiogram to see the valve in that billowing motion.
Exactly. An echocardiogram helps confirm the diagnosis.
And what about treatment for MVP?
The good news is many people with MVP don't need any treatment. If symptoms are mild, lifestyle changes like avoiding caffeine and alcohol can be helpful.
And if those lifestyle changes aren't enough?
Sometimes medications like beta blockers or anti-anxiety medications might be prescribed to manage symptoms.
But surgery is rarely needed for MVP.
That's right. Only in rare cases, if the prolapse is severe and causing significant problems, surgery might be necessary to repair or replace the valve. But for most people with MVP, surgery isn't needed.
Okay, so we've covered the major valvular disorders of the heart, from the aortic valve to the mitral valve. We talked about causes, symptoms, and treatments for conditions like aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation, and mitral valve prolapse.
It's been a good overview of these incredible structures, keeping our hearts beating strong.
And we've learned about some incredible advancements in medical technology, those pig and cow valves, transcatheter valve replacements.
It's amazing how far we've come in our understanding and treatment of valvular heart disease.
And before we move on, I think it's important to emphasize that early diagnosis and treatment are key.
Absolutely. The sooner these conditions are identified and addressed, the better the outcome is likely to be.
So anyone experiencing unusual symptoms, don't hesitate to reach out to your healthcare provider. They can assess your individual situation, listen to your heart, and determine if any further investigation is needed.
And remember, knowledge is power. The more we understand about how our bodies work, the better equipped we are to take care of ourselves, advocate for our own health.
That's what this deep dive has been all about, empowering you, our listener, with the knowledge to understand these incredible valves working tirelessly in your heart.
We've covered a lot of info today, but this is just the beginning. There's so much more to learn and explore. It's amazing how much we can learn just from listening. Before we move on, there's something in the book you might find interesting.
Oh, I'm all ears. Always love those extra bits of information.
Well, the textbook actually has links to YouTube videos. You can hear those S3 and S4 heart sounds we were just talking about.
Really? That's so cool. So our listeners can actually hear those subtle sounds, not just imagine them.
Exactly. It's one thing to describe a ventricular gallop, but hearing it, way more impactful.
I bet. Definitely adding those to my list to check out. Speaking of sounds, we talked about how murmurs are graded on a scale of 1 to 6. What else does the book say about those?
It mentions that murmurs can be accompanied by a thrill. That palpable vibration we can feel on the skin.
Right. So it's like the sound is so strong, it's literally making the chest wall vibrate.
Exactly. And there's even a link to a video where you can hear an AV fistula brute.
Wait, remind me, what's an AV fistula again?
It's an abnormal connection between an artery and a vein, often surgically created for dialysis patients.
Right. So the brute is the sound of blood rushing through that connection.
That's it. And it can be pretty loud, sometimes even audible without a stethoscope.
Wow. Okay, adding that video to my list too. It's amazing how much we can learn just from listening to the body.
Absolutely. Now, ready to dive back into those specific valvular disorders?
Lead the way. We were talking about aortic stenosis, that narrowing of the aortic valve. What else does the book say about that one?
One interesting thing is that people can be asymptomatic for decades. Might not even know they have the condition until it progresses.
Oh, wow. So it's like a silent threat for a long time.
In a way, yes. But as that valve narrows, it creates a bottleneck, makes it harder for the heart to pump it out to the body.
And eventually that extra workload starts to cause problems. The book mentioned a triad of symptoms that often develop together.
Right, the classic triad of aortic stenosis, angina, syncope, and dyspnea.
So chest pain, fainting, and shortness of breath. Not good.
Not at all. Indicates that the heart is really struggling.
What about on physical exam? Anything specific to look for with aortic stenosis?
The book mentions the carotid pulse, the one in the neck, might feel weak.
Because of the reduced blood flow?
Exactly. And then there's that split S2 sound, that lub T-tub instead of the normal lub tub.
Right, because the aortic valve is closing late.
Precisely. So diagnosing aortic stenosis involves putting all these clues together, the symptoms, physical exam findings, and test results.
Speaking of tests, what are the main ones for diagnosing this?
Chest x-rays, echocardiograms, ECGs, those are all helpful to visualize the heart, see how severe that valve narrowing is.
And sometimes a cardiac catheterization?
Sometimes, yes. To get a more detailed look, it allows for a really precise assessment of the valve.
Okay, let's talk treatment. The goal is to improve blood flow, ease the strain on the heart. What are our options?
Medications can definitely help manage symptoms and slow progression. Diuretics to reduce fluid buildup, beta blockers to slow the heart rate and lower blood pressure, nitrates to help widen the blood vessels.
But sometimes medication isn't enough, right?
You're right, surgery is often needed to actually fix the valve problem, and that's where those valve replacement options come in.
Ah, yes, the pig and cow valves. What's the rundown on those?
So you've got your mechanical valve, super durable, but they require lifelong anticoagulation therapy, to prevent blood clots.
Because the body sees those synthetic materials as foreign, right? Tries to form clots around them.
Exactly, and that's where biological valves, made from animal tissue, are a good alternative.
It's still amazing to me that we can use animal tissue for this. What are the advantages there?
The big one is they don't require long-term anticoagulation. Huge plus for people who can't manage those medications.
Makes sense. But I'm guessing there's a trade-off.
There is, yeah. Biological valves don't last as long as mechanical valves. They'll wear out eventually and need to be replaced.
So it's a balancing act, durability versus the risks of anticoagulation.
That's it. The decision about which valve is best is made on a case-by-case basis, taking the individual's age, health, lifestyle, all that into account.
We also briefly touched on TVR, transcatheter aortic valve implantation. Tell me a bit more about that less invasive option.
It's a really neat procedure. A new valve is inserted through a catheter in the groin, no open heart surgery required.
So it's a much gentler approach.
Definitely. Especially beneficial for older adults or those at higher risk from traditional surgery.
It's a game changer. Okay, aortic stenosis, covered. Let's switch gears to aortic regurgitation, just to remind our listeners that's where the aortic valve doesn't close properly. Blood leaks back into the left ventricle,
Think of it like a door that doesn't shut all the way. Some of that blood meant for the body ends up back in the heart.
creating extra work. We talked about some potential causes, damage to the valve leaflets, rheumatic carditis, endocarditis. Anything else to add to that list?
Yes, as we get older, the aorta, that big artery, can lose some of its elasticity.
Like a rubber band that's gotten stretched out.
Perfect analogy. And that stretching can affect the aortic valve, make it harder to close tightly.
Interesting. What about symptoms? How does aortic regurgitation usually show up?
Early on, you might not notice anything, but as it progresses, you might start to feel your heart pounding, especially when lying down.
Lying down, why is that?
Because when you lie down, more blood returns to the heart, and that leaky valve, it becomes more noticeable, like turning up the pressure on that leaky faucet again.
I see. And as the left ventricle works harder to compensate, you might start to feel tired, short of breath, even chest pain. We also discussed the water hammer pulse.
Right, that strong, bounding pulse, a classic sign.
So diagnosing this condition involves more than just checking the pulse, right?
Absolutely. We consider the symptoms, physical exam, and results from tests like echocardiography, chest x-ray, ECG.
And a cardiac catheterization sometimes.
Yes, to get a more detailed view.
Okay. Treatment time. What are the options for aortic regurgitation?
Often a combination of lifestyle changes, medications, and possibly surgery. Simple lifestyle changes like watching sodium intake and managing stress, those can help.
Take some of the burden off the heart.
Exactly. Medications like diuretics, beta blockers, and vasodilators can also help manage blood pressure, improve heart function.
But if it's severe, you might need surgery, right?
If the regurgitation is causing significant problems, surgery to repair or replace the damaged valve might be the best option.
And just like we talked about before, there are mechanical and biological valves to consider.
Yep, the choice depends on the individual patient.
Okay, aortic valve done. Let's move on to the mitral valve now. Starting with mitral stenosis.
Mitral stenosis, remember, that's a narrowing of the mitral valve, that gateway between the left atrium and left ventricle.
Right.
And the most common cause is rheumatic carditis.
That inflammatory disease we were talking about earlier.
Exactly. It can really damage those heart valves, make them thick and less flexible.
So how does this narrowing impact how the heart functions?
As the mitral valve narrows, it's like a bottleneck. Harder for blood to flow from the left atrium to the left ventricle.
So the left atrium has to work harder.
Exactly, like pushing a shopping cart through a narrow doorway. It takes more effort.
And over time, what happens?
The left atrium can enlarge. And as pressure builds there, it can back up into the lungs, leading to pulmonary hypertension.
High blood pressure in the lungs. What are some symptoms someone might experience?
Fatigue and shortness of breath, especially with activity, those are common. Also palpitations, that feeling of a rapid or irregular heartbeat.
And in more serious cases?
People might have trouble breathing even when lying down, might need to sleep propped up. Could also have that cough that produces pink frothy sputum.
That doesn't sound good. What does that mean?
It's a sign of fluid buildup in the lungs. Happens when the heart's not pumping well.
And when listening to the heart, is there a specific sound that indicates mitral stenosis?
You might hear a distinctive murmur. It has this rumbling quality to it. Happens during diastole. It's the sound of blood trying to force its way through that narrowed valve.
So to diagnose this, you take into account the symptoms, the heart sounds, and the results from tests, right? Like an echocardiogram, chest x-ray, ECG.
Exactly. Putting all those pieces together helps us arrive at an accurate diagnosis.
Okay. What about treatment? What are the options for mitral stenosis?
As with most heart conditions, the approach depends on the severity and the individual's health. In mild cases, lifestyle changes can be really beneficial, reducing sodium intake, managing stress, those kinds of things.
And medications too, I imagine.
Absolutely. Diuretics, beta blockers, and blood thinners can all play a role, help manage symptoms, prevent complications.
But often you might need surgery to address that narrowed valve, right?
Right. There are a few different surgical options available. One is a commissurotomy. Remember those valve leaflets? It's where those are separated.
It's like unsticking those doors to the valve.
Precisely. Another option is balloon valvuloplasty. That's where a balloon is used to widen the valve.
And if those aren't options, you can always replace the valve.
Yes, if the valve is too damaged, valve replacement might be the best course of action.
All right, mitral stenosis checked. Let's move on to another common mitral valve problem, mitral regurgitation.
Mitral regurgitation, also known as mitral insufficiency. This is where the mitral valve isn't closing properly. Blood leaks from the left ventricle back into the left atrium.
So another leaky valve situation, but this time it's the mitral valve that's not doing its job.
Exactly. Not all the blood gets pumped out to the body. Some flows backwards. This puts a strain on the heart.
What are some of the usual suspects behind a leaky mitral valve?
Could be damage to the valve leaflets themselves or to the chordae tendineae, those cords that anchor the leaflets.
Right. Rheumatic heart disease and endocarditis, they can lead to this too, right?
Yes, definitely. They can damage the mitral valve. In fact, rheumatic heart disease is a leading cause of mitral regurgitation worldwide.
So taking care of our hearts is crucial. Now, how does this backflow affect the heart and body as a whole?
Well, that backward flow can overwork the heart. You'll see enlargement of the left atrium and ventricle.
And an enlarged heart isn't as efficient.
Exactly. It can also lead to pulmonary hypertension. That extra blood in the left atrium backs up into the lungs.
So similar to what we saw with mitral stenosis, we get that backup of blood into the lungs.
Right. And in severe cases, it can lead to heart failure. It's serious.
What symptoms might someone with mitral regurgitation experience?
Fatigue, shortness of breath, especially during physical activity, those are common. You might also have palpitations, dizziness, even swelling in the legs and ankles because of fluid buildup.
And what about the heart sounds? Anything specific to listen for here?
You might hear a diminished S1 sound, that lub sound.
Why would the lub sound be diminished?
Well, the valve isn't closing as forcefully because it's leaky, so the sound is softer.
Makes sense. And what about a murmur?
Often there's a characteristic murmur, kind of a blowing sound that happens during systole. It's literally the sound of blood leaking back through that valve. The textbook even has a YouTube link so you can hear what that murmur sounds like.
Oh, that's really cool. I'm going to have to check that out. So to diagnose this, you're considering the symptoms, those heart sounds, and doing diagnostic tests.
Exactly. We use all of that to paint a picture of what's happening.
And treatment for mitral regurgitation, what does that look like?
It varies, just like with other valvular disorders. It depends on the severity and the person's overall health. Sometimes lifestyle changes can be enough, like watching sodium intake and managing stress.
Those are always good things to do anyway.
They really are, and medications like diuretics, ACE inhibitors, and beta blockers can also help. Control blood pressure, reduce fluid buildup, improve heart function.
But sometimes you need to do more.
Right. If it's more severe, surgery to repair or replace the valve might be necessary.
And you have those surgical options we talked about before, like annuloplasty.
Yes, that's where we tighten the ring around the valve.
Reinforce the doorway, so to speak.
You got it. And if the valve is severely damaged, we might need to replace it altogether. Just like with the aortic valve, there's the choice between mechanical and biological valves.
Got it. Okay, mitral stenosis, mitral regurgitation, all covered. We have one more mitral valve disorder to go over. Mitral valve prolapse.
Mitral valve prolapse, or MVP, it's all about the leaflets of the mitral valve. They don't close smoothly. One or both leaflets bulge back into the left atrium during systole.
So it's not a narrowing or leaking, but a bulging. Interesting.
Right. We often call it a floppy mitral valve because the leaflets just aren't staying in their proper position.
And this is more common in women, right?
That's right. The exact cause is often unknown, but it can be associated with connective tissue disorders.
What I found really interesting was that many people with this don't have symptoms.
It's true. Lots of people live totally normal lives not knowing they have it. And for those who do experience symptoms, they can vary a lot.
So what are some of the symptoms people with MVP might experience?
It could be chest pain, palpitations, fatigue, shortness of breath, lightheadedness, even difficulty concentrating. Some people also report feeling anxious or having panic attacks.
So the symptoms aren't always just physical.
Right. The mind and body are very connected, and heart conditions can show up in both ways.
Is there a specific sound you listen for to diagnose MVP?
Yes, one of the hallmarks is a click sound heard during systole.
A click sound. What causes that?
It happens when the valve leaflets prolapse or billow back into the atrium.
Okay. So to diagnose, you listen for that click and use an echocardiogram to visualize the valve.
Exactly.
And how do you treat MVP?
Good news is many people don't require any treatment at all. For mild cases, lifestyle changes can be helpful, like cutting out caffeine and alcohol.
And if those aren't enough?
Sometimes medications like beta blockers or anti-anxiety medications can be used to manage symptoms.
But surgery is rare, right?
Right, in rare cases, if it's severe and causing problems, surgery to repair or replace the valve might be needed. But for most people, it's not necessary.
Okay, so we've covered a lot in this deep dive. We've explored the world of heart valves, talked about various disorders. We've discussed aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation, and mitral valve prolapse.
It's been quite a journey into these amazing structures that keep our blood flowing the right way.
And we've talked about some really incredible advancements in how we treat valvular heart disease.
It's truly remarkable how far we've come.
And I think it's important to remember that early diagnosis and treatment are key.
Absolutely. The earlier we catch these conditions, the better.
So if you have any concerns about your heart health or you just don't feel right, talk to your doctor.
They can help you figure out what's going on and make sure you get the care you need.
And remember, knowledge is power. The more you understand about your body, the better equipped you are to take care of yourself.
Absolutely.
And that's what we've been trying to do today, equip you with knowledge about those incredible valves that are working hard in your heart.
We've covered a lot of information, but this is just the start. There's a whole world of information out there.
Now, I want to leave our listeners with one final question to think about.
Woo, I like this.
Now that you've learned about the sounds and rhythms your heart makes, will you listen to your own heartbeat differently?
It really makes you appreciate the amazing things happening inside us every second of every day.
I don't know about you, but I'm definitely going to be listening more closely. And for our listeners, if you want to hear some of those sounds, check out the link in our show notes. You can find videos at the S3 and S4 sounds, and even a recording of that AV fistula brute.
It's a great way to really understand what we've been talking about.
Well, it's been a pleasure exploring this topic with you.
Likewise, thanks for having me.
We've learned so much about these hidden heart conditions today.
Yeah, it's like we've been on this incredible journey inside the heart, listening to those valves working.
And it's fascinating how connected everything is. One tiny valve malfunction can have effects throughout the entire body.
It really shows you how important it is to pay attention to what your body's telling you.
Absolutely. Even subtle things like fatigue, shortness of breath,
Right.
feeling your heart racing a little more than usual.
Those can be early warnings.
Exactly. It's like your heart trying to tell you something's up.
And with valvular disorders, early diagnosis is so important.
Couldn't agree more. Catching things early can really make a difference.
Absolutely. So if you're at all concerned about your heart,
Yeah,
or if something just doesn't feel right, don't wait. Talk to your doctor.
they can figure out what's going on, get you the help you need.
It's always better to be safe than sorry.
And remember, knowledge is power. The more you know about your body, the better you can take care of yourself.
Absolutely. Understanding your body is so important.
And that's really what this whole deep dive has been about, helping you understand those incredible valves working in your own.
We've covered a lot of information, but like we said earlier,
There's always more to learn.
exactly, this is just the tip of the iceberg.
So stay curious, keep learning,
Definitely.
and most importantly, listen to your body.
Sometimes the most important messages are the quietest.
Well, it's been a pleasure exploring this topic with you.
The pleasure was all mine. Thanks for having me.
Until next time, keep those hearts healthy and those minds curious. We'll catch you on our next deep dive. Bye for now.